This morning's press conference did not allay our concerns whatsoever about opening up our public healthcare system to private, profit-motivated corporations, and that's exactly our biggest worry.
At the end of the line, is the change you're going to make improve the lives of those patients and families? And that's the measure. There are risks here.
And those are concerns from the opposition as the Conservatives announced sweeping changes to Ontario's healthcare system, including the creation of a super agency called Ontario Health to oversee the system, as well as merging of the 20 existing health agencies into one. So that includes Cancer Care Ontario, eHealth Ontario, and Trillium Gift of Life Network. Now, as a one-time health critic and patient ombudsman, Christine Elliott's spending years listening to concerns of the sick and frontline healthcare workers, and she is now health minister. Determined to see some change. You join us now this morning. Thank you so much for coming in today. You heard from the opposition, and one of the biggest concerns is the idea of privatization. And so I want to ask you, is privatization off the table?
Yes, it is off the table. The whole goal of this transformation is to strengthen our publicly funded healthcare system and to center the system around patients and to make sure that patients get connected care throughout their healthcare journey. That's not happening now. People are frustrated. They're not happy with the system, and that's why we're bringing about this change, both for patients as well as providers who want to be able to connect with each other for the benefit of their patients.
Theoretically, it sounds like a great idea, and a lot of people just have questions on how it's going to be implemented. It's not going to happen overnight.
That's right.
How will this system work? What are the first steps to make this reorganization?
Well, of course, we've got the legislation that was introduced in the legislature yesterday, and so, of course, that would need to be passed, which I hope it will. But once that is done, we are setting up the Ontario Health Agency, the big agency that's going to plan and coordinate care for the entire province to make sure that wherever you live, in Ontario, Northwestern Ontario, Toronto, Eastern Ontario, you will get the same level of excellent care. We will then be receiving applications from local Health Ontario teams, provider teams, who will be delivering care in the communities. So for patients, patients should continue to access care in the same way they always have, and our goal is to make this a seamless transition.
How is it different with, so the LHINs, Local Health Integration Networks, which were put into place for that very purpose, have been criticized in the past, but how do we ensure that we are getting rid of all of the bureaucracy and just making sure this is a clean system?
Because that's the way we've structured it. We've structured it so that the local Health Ontario teams that are going to be set up are going to consist of providers that are already there. So it may be, for example, a local hospital, a home care provider, and maybe mental health and addiction service provider will come together in whatever way they see fit. If it's a joint venture, a partnership, whatever it's going to be. It's a non-profit organization if they form anything more structured. And so they will be the ones that will be planning and, in some cases, delivering care locally.
From some of the information coming from your handouts here, it says eliminating duplicative back office infrastructure and administration. When someone reads that, it implies that there are going to be job cuts, job losses. How do you respond to that?
I would say that that is not the point of this exercise. What we're doing this is we're doing this for patients and to make sure that patients receive the best possible care. There is still going to need to be some administration in the local Ontario Health teams as well as in the big Ontario Health offices. So there will still need to be those functions that have to be completed.
Is it possible down the road within these years of transition that there could be jobs eliminated?
That's not our goal. Our goal is to make sure that we change the system for the benefit of the patients, and that's really going to be up to the local Ontario Health teams once they get comprised to see what administrative assistance they need. And then, of course, on the front line, we want to put more people on the front line. So they're the home care services that are already being performed through the LHINs. We will continue with those. We still need home care. So most of the people that are there are going to be continuing to do their work.
I think we're all in agreement that our healthcare system needs a revamp. We need to improve. I want to bring in some clips from those who represent the frontline workers and their reaction to your announcement yesterday. So let's have a listen to this.
The biggest question the OMA has is the how of it. We agree with the what, we agree with the why. We'd like to see what the how is.
Well, I didn't hear the minister say it would end hallway medicine. It's about reducing red tape, it's about reducing the amount of unnecessary third-party oversight, and that's clogging the ability of the system to deal in a hands-on way with the healthcare needs of individual patients.
Okay, we have overcrowding, we have people on wait lists, we have hallway healthcare. Will this new system under Ontario Health be able to unclog all of that?
Yes. Yes, and you can see that there are major problems in the system when you have over 30,000 people that are waiting to receive long-term care placement. We've got over 1,000 people every day receiving care in hospital hallways and storage rooms, and then there are thousands of people waiting for mental health and addiction services. So with these changes, for example, people will be able to receive their care at home. Many people right now, when they're discharged from hospital and need home care, they don't know who's coming, when they're coming, and what services they will be receiving. Care sometimes doesn't come for 4 or 5 days. Complications arise in the person's condition, and they end up back in the hospital emergency department. Similarly, if you take a look at what Cancer Care Ontario is doing now, we want to replicate that excellent model to other chronic disease management strategies, particularly mental health and addictions.
With these local health teams, I assume you're going to start small and then continue to expand and try to figure out if this is working.
Yes, we've had a number of organizations already in touch with the ministry saying that they would like to be early adopter sites. So providers are very keen to get started with this. They've been waiting for a transformation because they feel that the system is really fragmented, that they don't have the ability to follow their patients' care and be connected for the patient's benefit. So a lot of people are quite excited about this.
A lot of work to be done. All right, thank you so much, Minister. I appreciate your time today here on BT. We'll continue to follow this story, bttoronto.ca for more. Also, we'll have more on your weather and all the cancellations. Isn't that fun? We'll be right back.